Doctor, we are having a comment over here. Okay, it means
Sure.
related to question only. What
Mhm.
are the best treatment option available for colon cancer in older patient, and how we
Okay.
can help improve our how we can improve means during the treatment, life during the
So,
treatment.
so older patients, we all define, we don't go by the age of the patient, we go by how the patient is performing. Sometimes you will see that 80-year-old people function like 60-year-olds or 40 year
Yeah.
old, and sometimes 40-year-old patients look like 80-year-old or they function like 80-year-old. So we don't go by age, we try to give the best treatment possible to older patients. Depending on the stage of patient, from stage 1, 2, or 3, the best treatment is to undergo surgery. For stage 3 patients, after
Mm-hmm.
surgery, we recommend getting adjuvant chemotherapy. That might change in future depending on the results of the DNA and the clinical trials coming up, by which we can find out which patients need chemotherapy or which patient can do very well without chemotherapy. There are many patients in which we give chemotherapy, but still the tumor comes back. So we are trying to find out those newer ways to find out those areas where patients don't need chemotherapy.
Okay.
Now, stage 4 patients is the case where chemotherapy is inevitable. We have to give chemotherapy for the stage 4 patients because the tumor has gone to different parts of the body, and that's how we define stage 4. In older
Oh,
patients, we try to give gentle chemotherapy. There are many clinical trials which have shown that even with older patients, if you give chemotherapy, their quality of life is really good after getting chemotherapy. So it all depends what is the age of the patient. It all depends what kind of other medical problems these patients are having. Do they have diabetes? Do we need to fix doses of the pre-medications which we give before diabetes? Do they have kidney disease? Do they have any pre-existing neuropathy or nerve damage which has happened before from prior conditions such as diabetes? All these things are taken into account before we treat older patients. But yes, if the patient is old, it doesn't mean that they don't need treatment. We always give treatments if the patient is able to tolerate and if
yeah.
patient is a very, very well functioning patient.
Okay. Thank you, doctor, for the
Welcome.
for that detailed explanation and all.